morning. Please have a seat. I know you've been anxious waiting for your CT scan and biopsy reports. Before we discuss them, how have you been feeling?
Honestly, doctor, I'm very scared. I haven't been sleeping. My family keeps asking what the reports say. Is it really cancer?
I understand your anxiety. I have reviewed all your reports carefully. The biopsy confirms that the lung mass is lung cancer. I know this is difficult news to hear, but I want you to know that this is not the end of the journey. Today, lung cancer has many treatment options, and the next step is to choose the treatment that is most appropriate for you.
Doctor, did I do something wrong? Is it because I smoked?
Smoking is the most common cause of lung cancer, but it is not the only cause. Many people who have never smoked also develop lung cancer because of genetic changes, environmental pollution, passive smoking, occupational exposure, or simply bad luck. Right now, blaming yourself won't help. Our energy should be focused on treatment.
Can you explain my reports in simple language, doctor?
Certainly. Your CT scan showed a mass in your lung. The biopsy tells us exactly what kind of growth that is. It is non-small cell lung cancer, which is the most common type of lung cancer. Now, the most important question is not simply, do you have cancer? But how far has it spread? This is called staging, and staging determines the treatment.
Haven't I already had enough tests, sir?
I understand it feels overwhelming, but these tests help us avoid unnecessary or incorrect treatment. We usually recommend PET-CT scan to determine whether the disease has spread elsewhere in the body. MRI of the brain if clinically indicated, because lung cancer can sometimes spread there. Blood tests to assess your overall fitness. Pulmonary function tests to see whether your lungs are strong enough for surgery. Molecular testing of the biopsy sample. PD-L1 testing.
I don't understand molecular testing. Isn't cancer just cancer, doctor?
That's an excellent question. Earlier, all lung cancers were treated almost the same way. Today, we know that every cancer has its own genetic fingerprint. We test for changes such as EGFR, ALK, ROS1, BRAF, MET, RET, KRAS, NTRK. If one of these mutations is present, we may be able to use targeted medicines that attack only the cancer cells while causing fewer side effects than chemotherapy.
And what is PD-L1, doctor?
PD-L1 is a protein that helps us decide whether immunotherapy is likely to work well. Immunotherapy helps your own immune system recognize and attack cancer cells. Depending on the PD-L1 level, some patients can even receive immunotherapy alone without chemotherapy.
Suppose the cancer is still in the lung. What happens then, sir?
If it is stage 1 or stage 2 and has not spread, surgery is usually the best treatment. The surgical oncologist removes the affected part of the lung along with nearby lymph nodes. Depending on the final pathology report, chemotherapy, targeted therapy, or immunotherapy may be recommended afterward to reduce the risk of recurrence.
What if surgery is not possible, sir?
If surgery is not safe because of poor lung function or other medical problems, highly precise radiation therapy, sometimes called stereotactic body radiotherapy, SBRT, may provide excellent control for selected early-stage tumors.
What if it is higher stage like stage 3, doctor?
Stage 3 is more complex. Many patients receive chemotherapy together with radiation therapy. Some patients whose disease responds well may receive immunotherapy afterward. Selected patients may undergo surgery after initial treatment if the tumor becomes operable.
What if it has already spread or become stage 4?
Even if the cancer has spread, treatment is still worthwhile. Our goals are to control the disease, reduce symptoms, improve quality of life, and help patients live longer. Treatment may include targeted therapy if a mutation is present, immunotherapy, chemotherapy, radiation therapy to relieve pain or control specific areas, medicines to strengthen bones if needed, palliative care for symptom control. Many patients continue working and living active lives during treatment.
Everyone tells me chemotherapy is terrible. Will I definitely need it, doctor?
Not necessarily. Some patients only need surgery. Some receive targeted tablets. Some receive immunotherapy. Others benefit from chemotherapy alone or in combination with immunotherapy. Treatment is individualized.
Will I have side effects like hair loss?
Some chemotherapy medicines cause hair loss, while others do not. Targeted therapy usually causes skin rash or diarrhea rather than hair loss. Immunotherapy has different side effects because it stimulates the immune system. Whatever treatment you receive, we monitor you closely and manage side effects promptly.
Can lung cancer be cured, sir?
Early-stage lung cancer can often be cured with appropriate treatment. Even advanced lung cancer can sometimes be controlled for many years with modern targeted therapy and immunotherapy. Every patient is different, so we avoid making predictions until all investigations are complete.
What should I do now?
Stop smoking completely if you smoke. Eat a balanced, protein-rich diet. Stay physically active according to your strength. Take medicines exactly as prescribed. Do not miss follow-up appointments. Immediately report fever, breathlessness, or severe side effects.
Doctor, should we start treatment immediately?
Yes, but not in a hurry that compromises planning. A few extra days spent completing staging and molecular testing often helps us choose the best treatment instead of simply the fastest one.
Doctor, I'm still frightened.
That's completely understandable. But remember this, you are not fighting this disease alone. A team of specialists, including a surgical oncologist, medical oncologist, radiation oncologist, radiologist, pathologist, nurses, physiotherapists, nutritionists, and palliative care experts will work together to give you the best possible care. Oncos-India is there for you. Just take one step at a time. Today, our goal is to understand your cancer completely. Tomorrow, we begin treating it with a clear plan.
Thank you, sir. I came here expecting only bad news. I'm leaving with hope and a plan.
Hope is an important part of treatment. Together, we'll move forward one step at a time.